Hello, everyone. I am very excited to present today's talk to you in that it's a little bit new for me. I'm much more used to presenting experimental data, and today's talk is going to be much more conceptual, but based on some of the research that I've done in the cooperative care space and some of the applied work I've done as well. And so today we're actually going to have a dialogue sort of between us about how we operationalize cooperative care, which also requires us to define assent, dissent, assent withdrawal, and identify some minimum procedural requirements. So when you're looking at this video, for those of you familiar with cooperative care, we would probably label the procedure that we're seeing here a cooperative care procedure. This is one of my undergraduate students at Carroll University training her shelter foster dog to get his ears cleaned. And there's this really, I think, beautiful dialogue between trainer and dog in that she's presenting him with some information about what the procedure is, such as this mat and the ear cleaning instruments. And that signals to him what responses are going to contact reinforcement and what procedure is going to be performed. And then he's communicating back to her with his chin rest behavior there, whether the procedure can start and maintain. And he can also essentially say, no, please end the procedure by engaging in alternative responses that are not shown here. Similarly, here's another undergraduate student working on training a shelter dog to get her nails trimmed. And again, there's a similar dialogue here whereby discriminative stimuli are present, which provide information to the dog about what procedure is going to be performed, what behaviors will contact reinforcement. And the dog is then communicating back to the student by engaging in particular behaviors that the procedure may begin and maintain. And the dog has also a learning history whereby she can engage in responses indicating when the procedure should end. And so my question to you all is, we would call this cooperative care, but what makes it cooperative? Like, how do we define a cooperative care protocol? What components are necessary for that? And so for those of you who are not familiar with cooperative care, let me tell you that historically, if an animal did not participate in a medical or husbandry procedure, our options were pretty limited in that we would have to use chemical sedation or physical restraint, like what you are seeing here, which can be very stressful for the animal and the caretaker, or the animal just might not receive the necessary care. That's really unfortunate. And to combat this, around 1989, the first cooperative care-like procedure was published. It's actually published in the video I'm showing you here, which was a video by the Brookfield Zoo, which showed their ability to train orangutans to engage in participatory behaviors for receiving insulin injections. And so what this means is that cooperative care, at least parallel procedures, have existed for almost 50 years across a variety of different species, responses, and medical needs. And I will say that cooperative care is a term that is widely used in zoos and in the companion animal space. And again, has been in existence for almost 50 years in some form or another, as a concept at least. And yet, we don't have a good definition for what makes a cooperative care protocol cooperative care. Like, how do I know if I'm looking at an animal engaging in a procedure, whether that procedure is indeed cooperative care or not? And so the best definition I could find was from a 2007 paper, which indicated that cooperative care is an assent-based intervention focused on reducing stress and increasing the animal's cooperation with veterinary or husbandry care activities. And so in other words, the main categories here are that the protocol involves meaningful choice by the animal through assent responses, and also the focus is on reducing engagement in avoidance or escape responses so the animal can receive necessary care. And what's really interesting is that both of these components must be present in that just because you see a protocol or you see a video of an animal who's not trying to escape and who looks relatively relaxed, that does not mean that the behaviors you are seeing involves meaningful assent by the animal. You can coerce an animal to appear relaxed. And so what that means is we need to really look carefully at the fact that cooperative care procedures are assent-based interventions. But how do we define assent? Like, what is an assent-based intervention? And we can, again, look to the literature here. I'm going to share with you a definition that I really like. However, it is more conceptual. It's relatively squishy. It's not very operational. And then we're going to make it more operational in just a second. So this 2024 paper by Morris et al. Indicated that assent is the affirmation that an individual who is not legally authorized to consent for themselves indicates a willingness to participate in a procedure after they have received adequate information about the procedure and after someone with legal authorization has already consented to the individual's participation, and that the assent responses are performed free of coercion. So there's a lot to unpack here. We use the term assent because consent is for individuals who are legally authorized to consent. That is not children, it is not animals, and it is not some human adults. And so we can take consent off the table entirely. Animals can, by this definition, only engage in assent. And what's interesting about this definition is it indicates a couple different things. The assent response indicates a willingness to participate. Well, how do we measure a willingness to participate? That's very conceptual. That is not operational at all. And assent responses are also only considered assent if the individual has received adequate information about the procedure, so they essentially know what they are assenting to. And so in order to make this more operational, we've taken this from more of a behavior analytic lens. And I want to share with you how we think we would define an assent response based on the definition I've just shown you. We would say that in the presence of relevant discriminative stimuli, meaning cues to the animal what the procedure is that's about to happen, and contingent upon caretaker consent, an assent response would be any predefined response that occasions the start or continuation of a procedure. And if we're going to have an assent response, a meaningful assent response, the animal must also be able to opt out of the procedure, meaning that an assent response must be in the absence of a dissent or assent withdrawal response, which we will define next. Dissent response would be the absence of the assent response or the occurrence of a predefined response that has historically prevented the procedure from beginning. So it's any response that says, no, the procedure may not begin before it has begun. And an assent withdrawal response we would define as the cessation of an assent response that was already present, or the occurrence of a predefined response that actually stops the procedure after it has already begun. So dissent responses and assent withdrawal responses are both ways for the animal to say no to the procedure, but dissent occurs before the procedure has begun and assent withdrawal occurs after the procedure has begun. And so for animals, all of these responses must be observable and consequential because they can't engage in verbal behavior. And so assent responses for animals might look like the animal standing on a mat or putting their chin on a mat, or like Cleo here, resting in lateral recumbency with her cheek against the ground. And similarly, those dissent and assent withdrawal responses must be observable as well. So dissent responses might look like they avoid putting their chin on that mat. They avoid touching the mat before the procedure has started. And the assent withdrawal responses might be they have put their chin on the mat, but then they lift it, or they get up off the mat after they have already been on it. Or it could be as simple as the animal walking away and ignoring the caretaker. So I'm going to show you a video here of just an assent withdrawal response. You will see the dog initially engages in the trained assent response, which is putting her chin on the mat, and then she will raise her chin to, which has historically stopped the procedure from continuing. So that's an assent response there, and then she engages in assent withdrawal response of lifting her chin, and the procedure stops. And so again, going back to, okay, we've defined assent now, we have ways for the animal to essentially say yes and say no. What makes a cooperative care procedure cooperative care? And so based on that initial conceptual definition I had read to you, and based on our definitions of assent and dissent, we propose 5 minimum procedural requirements, and I'm very open to a dialogue with all of you about whether these 5 are appropriate or not, because this is a new idea that we're throwing out there, and we'll talk about each of these in a different grouping. So the first grouping is that in order for something to be cooperative care, the procedure must be ethically permissible, which requires 2 components. The first being, as I had mentioned, caretaker consent, because assent cannot occur in the absence of the caretaker consent. And it also requires the minimization of coercion. You can't completely get rid of coercion, but you can minimize it. And the thing I want you to keep in mind here is that we could talk about coercion all day, but the basic idea is that as choice increases for the animal, the amount of coercion decreases. So more choice equals less coercion. And so you can increase choice and decrease coercion by programming in more than one way for the animal to access the reinforcer. You can program in, you can be really thoughtful about the selection of the reinforcer quality and quantity you're using. And you can be really thoughtful about when and how you present the reinforcer. In that, it would be the amount of choice decreases if the animal really, really, really essentially needs that reinforcer. So if you withhold rations, daily rations, if you withhold sleep, if you withhold water, that would certainly be considered higher levels of coercion because now the animal, essentially to stay alive, needs to engage in the procedure, whereas maybe they previously would not have assented without those things being withheld. The second category is that the relevant responses for assent, dissent, assent withdrawal must be established, meaning they must be taught to the animal and maintained. And so what this means is that there must be some skill acquisition training for all of these target responses. And you'll see here, this is me working with my pup Ruby. We are working on nail trimming, initial nail trimming, and she has learned the assent response of lying on the mat. That signals to me that the procedure may begin. And her assent withdrawal or dissent responses would be her not getting on the mat or her coming off the mat. So in order for the animal to engage in these responses, they must first be trained to the animal. And the last grouping of components is that the cooperative care procedure contingencies must support meaningful choice by the animal. And so what this means is that the procedure must have contingencies programmed in, whereby assent responses start and maintain the care procedures, but dissent and assent withdrawal responses continuously either prevent, pause, or stop those care procedures. And so the take home here is that those 5 components, I want you to think about whether those are appropriate or not, because I'm very open to feedback, but also that cooperative care, whether a procedure is considered cooperative care, is not defined based on what the animal's behavior looks like. It's really defined based on what are the components of the procedure that have been programmed in. And there are a lot of remaining questions in this space. We need way more research on how to teach cooperative care to people and to animals. And we have lots of questions about how to program in reinforcement in that should we just provide negative reinforcement for assent withdrawal and dissent responses, or should we also positively reinforce those, such as what Laura Monaco Torelli does? Should we intersperse reinforcement for responses other than the assent responses? Again, something that Laura Monaco Torelli suggests is necessary. And I haven't talked about this in this talk, but there are many ways to assent and dissent involving formal responses that are predefined, but also like behaviors indicative of discomfort in the animal. And are there potentially correlations between whether an animal engages in our predefined responses versus whether they engage in these more informal responses indicative of their discomfort with the protocol? I have references here for those of you who are interested, and I would like to thank our funders in the cooperative care space, which is fear-free. Please feel free to reach out with any questions. I'm very, very interested in having this dialogue with all of you, my colleagues. Thank you so much, everyone.